So what we're going to do now is we're going to go through a quick demo. And what I mean by quick is we could literally spend hours walking through every little detail of this application, which would bore you to no degree, and it's not everything you need to get started. You just need some basics of what the application does. So it's going to be a quick demo. At the same time, we will leave a lot of time at the end for all your questions, which I'm certain you'll have lots of. So hopefully we get to the big parts and take care of most of your questions before we get to the questions section. Let me get over to here. Okay, can everyone see my screen? Good. So the first thing we want to discuss here is that there are many roles. And when I hit the submit button, you're going to see that these are the roles available to a multi-site system. There's going to be the state central administrators, CAs, guest roles, supervisors, and users. I'm going to start this demo by showing you the user role. If you log in, you will see the dashboard that the user gets. This dashboard is linked to their worker. So you see up here it says worker dashboard. And what I want to explain really quick is that a worker is not the same thing as a user. When you log in, you just literally have a login. Your supervisor needs to go to the settings page, which I'll show you later, and to select a worker so that links your login with a specific worker in the program. That's why I logged in as C. Pappas, but my name is Gretchen, and you can't see all the details, but it's Alice Gretchen, which is a fake user we have set up in the system. So just be aware of that real quick. Users basically handle cases just like a FSS, FRS will. And under the settings page, which is just a real quick thing, because I'm going to switch over to supervisor real quick, you'll see that the only thing that a user can do is change their password or email. So I'm going to change my role, go into a supervisor, and you can see the supervisor's dashboard has changed. It has both the supervisor dashboard at the top, which talks about their case, any forms they need to review. It also has their worker dashboard, which only shows up if this supervisor is having a caseload. If the supervisor doesn't have a caseload, their worker dashboard won't appear here. So the first thing most people will do is going to want to search a case. There's two ways of doing that. You can click on a search case button here, or you can use a drop-down list, which will show you the last 10 cases you've searched so that you don't have to go click search cases. This is one of those searches which every single item you add adds to the search. So for example, if I'm searching for someone named Alice, it might not find anything with Alice, but if I know their PC1 ID started with A, it doesn't exclude Alice's, it shows all the A's. So it keeps adding to the search as you want to get more and more information on it. So that's just an important quick search on how the search cases works. So the case I want to show you though is, whoops, I'm gonna refresh this page. Yeah. Okay, so the most important piece you're going to run into, because you're going to use it almost all the time, is your case homepage. And so this is the basic information about a case. And the case has, I'm going to skip some of these tabs for now, so don't worry about them. But the forms, if you cursor over or mouse cursor over each of the forms, it'll explain to you what the form does and what it's for. The way our application is designed, a lot of these have to be done in order. For example, you can't do an intake form over here before you do a screen form. The screen obviously is first. It's the first thing you do to get into the system. There are some applications that allow you to put in things out of order just because they don't have a lot of validation on them, but a lot of our forms are what we call heavily validated. So for example, if you go to put in the intake form, and on the intake form, you say that this person has a high school education, but on the identification form, you specified, on the screen form, I'm sorry, you identified that this person had a college education. You're going to get a little red asterisk with a little statement saying that the education does not match up with a previous form. So there's a lot of validation on this application that requires some forms to be entered in order. You notice these two little X's here. This means that you have the supervisor review turned on, and one of these forms or more has not been approved by your supervisor. Since I logged in as a supervisor, I can click on this target child information form. I can then go down and approve it. And when I go back to the case homepage, under forms, you see there's a green check mark now. So that form's been approved by your supervisor, and that's how a user would know that the supervisor is going into their forms and reviewing them. And next item I want to touch on is all the great things you can do as a supervisor. So real quick though, for the users, under target child information, there's this download face sheet button. If you click it, a PDF will download for you. I just clicked it, and I'm hoping you can see my screen still. It shows the participant information, the primary caregiver, the child's age at intake, who's the target child, and just some basic information. This is also available for the target child medical information. So you can download their immunization report without actually getting into all the details by clicking on it. This will tell you the age of the child, the number of cases due for immunizations, and just some basic information about which about the child and their immunizations. If you go into the child immunization page, we follow the CDC guidelines, and you can see this case clearly has some vaccines entered. It tells you the date. They're in green, and they say done, but visually it's just a lot easier to have it in green so you can get a quick visualization of what's done and what's not done. The word true here just means is it optional or not. And one thing I want to show you real quick, because it's true at all of our tables, you'll see these up or down arrows all over the place. And that's so you can sort the data any way you want. So if you want to sort by optional, you just click it, and it moved all the true to the bottom. You click it again, and it moves all the true to the top. If you want to go by the name of the event, you get all your DTaps together, all your flus, you know, with the VZs at the very bottom, and you can click it again and then just resorts it back up that direction. You'll see this all over our website, and whenever you see it, it just allows you to sort everything any way you want. Settings. This is a big part for your supervisors. I'm not sure how many here are supervisors, but it's also really important for program management. There's a lot of things here that the user can't do that only the supervisor can. So as you saw earlier, as a user, the only thing the user could do was this self-service here for changing password. Starting over on the right, we're going to go to case filters. If you saw earlier, I'm going to open up this in a new tab. There's a case filters tab on here. There's nothing to show underneath it. If I'm a supervisor, I can create a case filter. So for example, let's say your program is getting special funding, and the funding is coming from, I don't know, we'll just call it federal funding. And they want you to serve in the next year, I don't know, 10 cases. You can say this is like a yes, no. And what you can do is after you create this Fed funding, you can now take a case and say the value here is missing. You can say this case is specific to Fed funding. By doing this, a lot of our reports have this case filter function built into it. We'll get to that when we get to reports. So you can run a report only for cases that have Fed funding. and those were the only cases that will appear in the report. It allows you to do a lot of types of special requests for either the governor might have a request for something and you might have to record your cases in a certain way. For example, we work with New Jersey, and one of the things they had to do was they had to mark cases that were affected by Hurricane Sandy, which came through in 2015. So this way they could run reports about only cases that were affected by the hurricane and then compare those numbers to other types of people who weren't affected to see if there was a difference between the way the long-term retention worked, that kind of stuff of issues. The next thing I want to go over is, this is where you would enter your medical providers, your facilities. This is where you would enter all your referral sources. If there's duplicates, like while only you can add and edit medical providers through this tool, a user, when they're entering a new case, if they say, who's the medical provider? If the medical provider isn't in the list, the user themselves can say, add new medical provider. Some users, if they don't look through the list carefully, might put in the same medical provider, medical facility, or referral source multiple times. Here, as a supervisor, you can go in there. You're not really removing the duplicates, you're really merging two together. These are your service referral agencies, which would be very important on your screening form. And this part's going to be of interest, I know, to a lot of programs who have multiple sites. This particular program already has 2 sites. So if you have a facility, I heard somebody say earlier, I think they serve 3 different counties, maybe 4 different counties. You most likely don't have just one program in one location. This is the location where you can put in the name of, say, each of your counties, and then you can link workers specifically to these sites. And those workers will not see other workers' cases. So they'll be specific to only them. So if they're doing a search for a case, these other sites' cases won't show up to them. This way you can actually have multiple branches of your program without one running into the other one accidentally updating a case they shouldn't be updating, that type of thing. Trainers are for the trainings. There's a list of trainers that can be added and edited on the fly. And then I wanted to show you this. This is accept transfer cases. This is only for multi-site systems. Through the demo itself, the demo login, you can't create a case to be transferred because it's not set up as a multi-site system. But if Oregon decided to go forward with a multi-site system, one program can transfer a case to another. So for example, the case, they're moving. We know this is a very transient environment of cases that we have here, and they move all the time. If they're moving to a different county, you can transfer them to a different HFA program inside of Oregon. And to do that, you would see this little 1 that would show up, which meant that some other program has already transferred this case to your location, your program. You do not have to accept the case. You see here, it's pending. You can choose to accept it, but you don't have to. If you do accept it, you would click the accept button and you would change the case to pending, or you can say you're not going to accept it, you're not going to enroll at all. If you do enroll it, we just want to know this case start date, what family support worker is going to be working on this case, and then you would submit, and you would have this case would be now part of your program. The delete duplicate screen is just in case someone put in the screen again and you want to delete it. A form review dashboard is a list of your forms that have to be reviewed. Only supervisors, again, would be doing this. It's listed as only the last 3 months will show up here. So if I click the load all forms button, it'll go back 5 years and find all the forms that I have not approved yet. So you can see here, there's 1, 2, 3, 4 unapproved forms for this work, the supervisor going back over a year. The partial home visit log review is there because a lot of people do home visit logs, a lot of users, I should say, and they don't complete them. If they're incomplete, they'll show up here, and then you can go over them. And here you can sort it by the worker, which is very helpful because you can see which worker isn't completing their home visit logs. Program documents is where your program may have specific documents. It could be training documents, though. It could be a document about what to do when you hire a new worker. It could be anything. This is where you as a supervisor can add program documents so that your workers can have access to them. And we'll show that later when we get to the help and docs section. Batch case reassignment is when you have one worker and that worker is leaving for whatever reason. You can choose that worker and see this worker has lots of cases. And if they have lots of cases, you can choose to assign each case to someone in the list, or you can choose the assign all button and all the workers will be assigned to the same worker. And if you want to switch it to Donna, you can choose assign all and they all become Donna. And if you went all the way to the bottom and hit reassign, all 52 cases would get reassigned to Donna. A group form is if you have it's not used in too much of our reporting, but there are times when you have multiple people coming over for some type of group session, you would use the group form. Program information form is about your program specifically. It's mostly used for report dates based on your contract information. You can update that right here. The supervision form is where you will, as supervisors, review your workers. So in this particular area, I would like to show you the, Christine Apple is what I want. So Christine Apple is the one who's going to be getting reviewed. These are the different supervisors. This is me, Gretchen Apple, 2149. And this is our supervision form. You put in notes about what you discussed. There's general topics you can talk about. There's also a case list selection, where this is all the cases from this worker and other workers too that you might want to discuss. You would click on them and you can add, you'll see that tab just showed up. If I choose that for a different one, you'll see that shows up over here. And then you can start discussing them. So on this particular one, we discussed the service plan. We also discussed the tools. Notice this little checkbox here, follow up at next supervision. You don't have to select it, but if you do, remember, this is the service plan for case AM97. If I go and create a new supervision for this worker, you'll notice this tab all the way to the right. It says activities prior session. So once I choose this is a regular scheduled session, I can click this activities and it will remind me that on the previous supervision, we talked about the service plan and there's more information that we want to update on this. It says right here, these topics were marked for follow-up in the following session. Training exemption is really used for workers for some reason who have already had trainings and you don't want to fill out all the details about their training. The training form is the best practice standards form HFA, and you would just mark off which trainings people had at certain times. And the worker form. This one is important because not only will you be entering a lot of information about your workers, this is where you link, notice the username at the top here. This is where you link the login with the user. Now I created a fake user called Lockout. And what I wanted to show you here was that on this particular form, Lockout, this person is locked out. So if I go back to the settings and to the worker form, you'll notice that if I click edit here, it says this user's account associated with this worker is locked out due to excessive failed password attempts. It's very possible that what happens a lot is that someone just types in their username wrong, and there's nothing wrong with that. But for security reasons, if a password is attempted 5 times and they got it wrong 5 times, we lock that user account out. They can contact tech support or they can talk to their supervisor. Their supervisor can come here and they can choose this button at the bottom here and unlock the account if they wanted to. And it also lets you know what email that unlock password information is going to go to, so that they can make sure that this is a legitimate user. It's not someone who might be disgruntled, who may have been trying to get back into the system after they were locked out. And back to settings. Okay, and before I move on much further, I think the best time now is to move on to Corey, who can talk more about the help system and the documents. So I'm going to stop my share and she's going to share her screen.
Okay, here I go. All right, so I'm going, can you see me?
I do not see your screen. Just,
let's see here.
I can walk you through it if you want.
Do you see me now?
Not your screen. I'll share my screen again. And
actually, Chris, I'm getting a message saying host disabled, participant screen sharing.
I like to do that. Try again.
And how about now?
Perfect.
Okay, great. Sorry about that. So I'm going to discuss this help in docs link, and the first thing I'm going to talk about is the technical support. So the fastest way to get a question answered by our support team is to submit a ticket, and here's the link right here. I'm going to have to, I guess, you can't see this screen. Can you see the support ticket screen?
Yes, we can.
Okay, great. So this is what you'll do. It takes you to a different window, and you just put as much detail as you possibly can into this help desk ticket, including the user's name and your phone number. The email address is really important to put a valid email address in there, because that's the way we're going to contact the users that have the questions. You'll see that your program name is autofilled, and you just want to put a subject in, like trouble logging in or a question about a case. It's a really good idea to put your case number and a brief description of what issue you're having, whether you're having an issue with a case or a report or a specific procedure. And then you would click submit here after you finish all of your information, and it goes directly to our support team. Notice here too, we have an opportunity for the user to attach a file. If you take a screen print, or if there's a report that you have a question on, you can actually attach the report. I'm going to go back here to help in docs. The next thing we have is a link to frequently asked questions. And so this is just, you know, over the years, we've documented a lot of frequently asked questions. So you can just click on these different links to get general questions, standards, MIS forms, keyboard shortcuts, which is something that the IT team is really proud of. They'll give you a list of the shortcuts that you can take without using your mouse, and questions on reports. Back to the help and docs. We also have all of our paper forms listed here. And again, as Chris said, you know, you can sort these in many different ways. The MIS training videos are all housed under help and docs as well. So we actually recommend that all new users go to this part of the application and take a look at all of the Healthy Families training videos and webinars that we have. We recommend that all new users go through this Getting Started video, as well as all 4 of these e-learning modules. They're really, really helpful for new users. The other thing that we recommend is the basic forms training. And the basic forms training is very valuable because it helps the new users to understand the MIS, what it's been designed for, the data collection system, and the hierarchy of the forms. And I think Chris touched on the hierarchy before. Basically, if you want to enter an intake, the parent survey has to be entered prior to the intake. So this basic forms training will take the user through a detailed description of the forms, of how the forms are entered into the MIS. Program documents, Chris was talking about before. This is a perfect opportunity for individual programs to upload their own policy procedures or confidentiality agreements, or basically any document that you want one click away, so your whole team, your whole program can view these documents. The news is where our IT team posts any new changes or updates to the system. You'll see a list of the changes with a brief explanation. And I just want to touch here just for a moment on something that we do for a couple of our programs. So we send out missives, and they are directly related to the news. And what it is a list of the new changes, updates to the MIS system with more detail. And if you guys are interested in receiving these missives that go out like monthly or even more frequently than monthly, then just let us know and we can create a listserv for your group, and you will get these missives along with the other programs that we send them to. Reset dashboards is simply exactly what it says. You know, your dashboard can be customized or it can be changed. Like, say if you want to change the way it looks, but then you want to go back to your default dashboard, you just click this reset dashboard button, and you'll get the dashboard view in the default way. And that's all I have. So I'm going to give it back to Chris now.
Okay, I'm gonna share my screen again. And okay, so the key piece I think everyone's gonna wanna look at, they're excited about, is always reports. As you can see at the bottom here, there's 118 entries, so we can't possibly go through every report, but they all work in relatively the same way. The first thing I wanna show you is that you have them in these categories. So there's certain reports that are like ticklers. So you can categorize them a little bit more quickly by just choosing ticklers, or analysis reports. Paging is done here, but if you want to sort by report name, you can always click it this way and move everything around. If you do get lost, you don't know what a report's called, you don't know where a report's located, because there is a lot of them in training, multiple pages down here, multiple pages in accreditation, and you just don't know what it is, but you know it's got something to do with, say, home visit logs. You can just start typing the word log, and anything that has the word log in it will just show up. The only thing to remember about this is if you click on ticklers, it'll be empty because it's still working off this search for log. So just delete your log and that'll go away. All the reports work very similarly. This particular report's a very simple report. It's just an FRS tickler. And if you run this report, I want to show you something that's true about all of our reports. There's paging up here. So you can either click for the next page, go to the end page, or click a specific page. All the reports have a printing option. You can print just the current page, or you can print all the pages. And they also have the save option, either all the pages or just this specific window. And you can save it in all these types of formats. Adobe PDF, Excel, rich text, Word documents, CSVs, or even just an image of some kind. The other thing you're going to want to be interested in is what we talked about earlier with the case filters. Some of the more advanced reports that aren't simple, like just a tickler report, say an analysis, say a report on demographics. Actually, no, demographics is simple because it's just exporting data. Family support specialist home visit record. Here you can choose the specific site that you're interested in. This is what we were talking about before. It can either run for all sites in your program or a specific site, or you can choose this Fed funding option we discussed earlier with the case filter. And then you don't have to choose so that only Fed funding appears. You can check the not equal option right here, so that what would happen is that all the cases that aren't Fed funding would appear in this list. So if I ran this report now, we would get all the cases that are not linked to, whoops, there's no case, I'm sorry, there's no cases for this particular one. I've noticed that before. There's no data, we get nothing on our report. If I could run maybe a tickler would do that. It probably doesn't. Let me find another one that might have data. Observations by supervisors, no. I'll just try one more in accreditation. We'll see if we have any data for the 3 years. This is an old application, okay. Unfortunately, it's not gonna help us with that. There's no data there, but I'll say yes for the one. You're just gonna have to trust me that if there was data in the system, there's only like 100 cases, and all the cases, when we do a search, you'll notice that almost all the cases are either already discharged, or they're still in the pre-assessment phase, or they're still prenatal, et cetera. So there's not many cases here that have actually been put into the system since it's a demo site. But this is the location under these reports where you would specifically choose either your site or choose the filters that you're interested in. If you have more than one filter, more than one option can be used as it comes down. Now, Marguerite sent me a list of questions from someone who can't be here. So I'm going to try to answer each one really quickly, then open up to the rest of the people on this Zoom call. It says, can we download PDFs to a client's file? If you're doing it through a report, the answer is yes. I don't know, there are some, you can help me out here if you want to, Corey, but I believe that each of the forms, you can print the form. And if you,
so the paper forms can all be displayed to print,
right.
But also on every case, there is a tab with case documents, and you can upload case documents to the specific cases.
Right, she's looking at report, bringing them down though. And this is the area you'd want to go to print, I believe, a form. So you could download the file to your computer if for some reason you wanted to do that. But Corey's right, if you go to a case, if she meant, instead of download, she meant say upload, this is where you go to the case documents folder, or tab I should say, and you would add a specific case document about this case. For example, you might have the detailed ASQ actually completed, because all we collect for the ASQ are the 5 basic sections that are recorded. But if you have the whole ASQ document, you might want to add that right here.
And a lot of the programs use the case documents to upload the signed consent form as well. So they always have it right attached to the case for accreditation or peer reviews.
The next question was, what does supervisor dashboard look like? We saw that earlier. That would look like this top section right here. Do home visits completed and attempted get auto-populated into the case notes? They don't get populated into the case notes, but I don't know if what they're talking about maybe was that here in the case forms page, you will see all the home visit logs and other information that gets auto-populated. So if there was 37 home visit logs for this case, this would say 37 here instead of just 1. And when you click on this link, it would show all of them that are available, if that's what the person was asking.
And if it's a partial home visit, if it's not been completed, there would be a little P for partial next to the home visit. So going into a case, you can see what home visits have been completed and what are partially completed.
The next question she asks is the HFA level change document integrated into the home visitor's or family's profile? The answer is no, the document is not. That is something that you should do via the supervision. And then the document itself, say you were saving it in Word document or Excel, you can then upload the case of the file to the case using the case documents over here. How do New Baby Questionnaire, which is Oregon's screening tool, and parent surveys work here? I don't know if Marguerite wants to give us a little bit more information on that question. I'm not quite clear what that question is asking.
I'm not totally certain what she was asking either. So for our intake, we do a screening, which is what we use to determine eligibility using the New Baby Questionnaire. So I'm assuming that we would, the database would be customized. So our New Baby Questionnaire would be in here, and we'd be able to check off the items as they to determine eligibility and have that documented here. Is that accurate?
I don't know if that's accurate for the question, but what we could definitely do is we did this for when Nebraska signed up, was we did a dedicated form for them as well, which only Nebraska sees. It's obviously an additional charge. We'd have to see the complexity of the questionnaire. The other piece is not just the form, putting the data in, but probably someone would want some kind of reporting out. That's something we can definitely do, and we can discuss that with you at any given time. It's not something that has to be done prior to starting with our application. We can always add a new form for a particular state.
And then she was asking about the parent survey. You had shown me earlier the parent survey form that's built in as part of the application.
This is the current parent survey form with the scores. Yeah, is there something that might be missing or different? We know HFA has been going back and forth in the parent survey for about 5 years now. So we've been trying to stay away from updating this form too much, because every time we try to start changing this parent survey form, HFA is telling us they're creating their own and it's going to be validated and don't do anything. So we've been staying away from it. We'll see how that goes. But is that the question, what's involved here, or not? I'm not quite sure what you meant by how the New Baby Questionnaire and parent surveys work, but.
Can I throw something in there? This is Karen Tauscher. But what came to my mind that I think may be getting asked about is, Chris, when you showed us that things have to happen in a certain order, and you have parent survey first and then enrollment.
Correct.
And for HFO, we don't use the parent survey as the enrollment screen. We use New Baby Questionnaire. We enroll, and then we do parent survey.
So it's a one-step enrollment process?
Correct.
Yes.
Okay.
So I guess I was wondering, is this customizable to flip those two, enrollment and parent survey, in the order of, what gets put in there?
It's currently not customizable right now, but it's been something we've been working on, because one of our bigger programs sites is the state of New York, and they're currently doing a separate, thinking of the right word for it, prototype kind of application test by doing a one-step process. But your process doesn't sound one step. You are required to do the New Baby Questionnaire first. Is that correct?
My understanding was the baby screening questionnaire was the enrollment form. That's what you use to enroll the family. Is that correct?
We use the NBQ to determine eligibility, and then families who are eligible, some of them become enrolled, and they're enrolled as of their first home visit. And then in the first visits, we complete the parent survey.
Oh, you do the parent survey. It's just.
You do it, but it's after enrollment.
So you do a screen form. You screen the client, but you call it the New Baby Questionnaire. Is that what I'm getting at?
Yes. Yes.
Yeah.
You don't do it what we would call a screen form. You do a New Baby Questionnaire.
Yes.
And it asks significantly different questions than maybe our screen form does, or I'm not.
It asks the kinds of questions that are showing on the screen. It does ask. It asks about whether you having trouble meeting your basic living expenses. It asks some screening questions to get at depression and anxiety. It asks about prenatal care, early care and frequent care. It asks about if you have somebody you can turn to for support. It has a whole bunch of different questions.
Yeah, so we just asked these 2 pages of questions here, marital status, prenatal, and this information. That we would have to discuss in serious questions about customizing the application to handle this, because that would be a different piece. The screening form is really our starting point. We could rename the screening. We would have to like compare your new baby questionnaire with the screening form. It's possible. Anything's possible with programming. It's not a big deal. It's just time, effort that goes into it. We could probably rename the screening form to new baby questionnaire. And then you said you do the parent survey after you do the intake.
Mm-hmm.
Yeah, we'd have to have a discussion about these other forms. So for example, you don't do a pre-assessment activity form then because they've already been intaked as soon as you do the new baby questionnaire? Is that correct?
I'm not familiar with a pre-assessment activity form.
That's just once they do a screen, they'll come in here and they will mark that they have either what activities occurred since the screen. They'll specify if the assessment, which is the parent survey, has been completed. What date was that parent survey completed? Was it positive or negative? Did they assign the case, etc.? Then when they're done with that, they'll actually do the parent survey form. Then they'll do the pre-intake activity form, which is basically stating that the parent survey has been completed. At this point, they can still choose not to accept enrollment or not. But if they do accept, they would mark down the parent accepts enrollment. And this is the intake date of the client. So that's basically that's basically the way things work before you get to the ID contact form, where you basically lay out who's the mother, if there's another biological parent or a secondary primary caregiver on the case, any emergency contact that might be available, and that they sign the informed consent.
The pre-assessment and pre-intake forms are basically an opportunity for the programs to track outreach efforts by the FRS and the FSS.
Right. So we can have definitely a discussion about moving the parent survey. We've done this for New Jersey. The parent survey they are a one-step, New Jersey is. New York is not a one-step. You're looking at our generic model. New Jersey has a fully customized separate model that they have been using for 12 years and are constantly updating. But New Jersey uses theirs as the parent survey form goes after the intake. And they have a simple report just to make sure that they're getting done within 30 days, because that's kind of like their rule, that the parent survey must be done within 30 days of the intake. And then they have the screen form, which is very similar to this particular screen form. So it sounds like you have a different screen form, which is called NVQ. I bet you it's not too different than what we already have. So it's definitely something we can discuss. Doesn't sound like it'd be that terribly complicated, but it's something beyond the purpose of this Zoom call, I guess. This would have to be something where either your state leaders or whoever wants to take charge, I don't know if Marguerite's taking charge, to discuss how that would look and how that would work. But yeah, it's something we can definitely do. It's just not part of the current model, the way it's designed. The next question on our list was the training process and ongoing technical support, which Corey covered. Oregon specific requirements, I don't quite know what those other Oregon specific requirements are. It might be more than just the new baby questionnaire. Might be a little bit beyond the scope of this particular Zoom call, but we can discuss that afterwards if you'd like. She also asked subsequent program entries with other children. So this model is very specific and follows the HFA as close as it can. It's about the child that is, or it's around one birth, I should say, because it could be twins, it could be triplets. But we don't have other children being added in and being doing an ASQ form on, say, a 2-year-old who might already be in the house, or we don't, a next pregnancy, we won't add that child into it and start doing ASQs with them. This application is around that original birth, not future births, and not previous children. The next question is supervision entries, service plan notes triggered on supervisor's dashboard question. Notes are used on the supervision form. If that's the question, you can put in any notes you want on the supervision form and bring them up at the next supervision. This one looks like it's something Oregon specific. She asks about immunizations talking to or importing from something called Alert. I don't know what Alert is. Is that something they use in Oregon?
Yeah, it's an online immunization database. So we are able to, our program staff are able to log into the Oregon Alert system and find out what immunizations have been completed for a child.
Well, there's definitely no talking back and forth between our application and Alert, and I doubt the state of Oregon would allow us to just link directly into their PHI, application. But from the main page here, if you find out their immunizations, you just click on the target child medical information and you would enter the new information, the date of the visit, and what occurred. And so you just check off all the items that happened at that particular moment in time. And then you submit them and they become part of the target child's medical record. The next question she has is import options in general to Alert ASQ. Do you guys use ASQ online? Is that what she meant by ASQ?
I think some programs do and some don't.
We've talked to ASQ about that. They have an API. Unfortunately, the cost goes to you, the program. So if you want to open it up to allow us to use the API, it looks like it's going to cost you somewhere between 50 to 75 cents per ASQ done. Also that you can just link it. That's, I guess, up to you at some point in the future. The application works with, let me just go to the most one. Currently, what most programs do, we have another program that has ASQ online. They just pop into the ASQ score sheet. They put in the date. It asks those 5 basic questions. Whoops, wrong dates. 05, 15, 19. And then just ask the 5 questions. If you go way over, I think you can show, like if I did, you can see that it tells you the validation is only 0 to 60 is only a valid outcome. And then you submit it. So it does not link directly to the ASQ online, but that is something that can be done. However, the cost, like I said, falls onto you, the program. That's how, it's not ASQ who told us that. Hold for 1 second, I'll give you the name. It is Brooks Publishing who publishes the ASQ, who run the ASQ online. So Brooks Publishing was the one who told us that it is something that the cost falls onto the program. It's not something we would control on our end. And the last question she asked is about QA activities. So I'm not sure about Oregon's quality assurance activities, but if you want to specify some, we could discuss it.
I do want to touch on the question about other children in the family and subsequent births. It is true that our research and our data entry is focused on the target child and the target child, the PC1, but we do allow documentation in the follow-up form and I believe in the intake form of other children in the family and subsequent births after the target child is born. And we have a PHQ-9 that is required as per the best practice standards for subsequent births.
Right, here's the subsequent birth tab inside of the follow-up form. However, I just want to be clear that if you do specify there was a subsequent birth, we don't follow that child in this application. We record that child, but you're not putting in ASQ for that child. You're not putting in immunizations for that child. Mm-hmm. The only time you would ever put in immunizations for more than one child would be if the birth associated with the case was twins or triplets.
Right.
Okay, I am done with the questions that were asked from the person who couldn't be here. So let's open up to everybody else. Don't believe I covered everything. That's got to be something I missed.
Yeah, I have a question. This is Beth from Clackamas. Can you kind of walk through, like, so when we receive a referral on a family, we receive that first generally, and then are outreaching the family to do that screen, the new baby questionnaire. Is there a way to track those referrals in this system?
So what you're saying is when you get a referral, would you put in a new baby questionnaire right away?
No, so all we would have would be like information about the family, say from WIC, and we'd have mother's name, date of birth, whether she had a baby or was prenatal, and then the screeners, our community outreach team would then call the mom to try to do the new baby questionnaire
Right. So
with her.
that's exactly how our system is actually designed. So let me just put in someone like Carla Smith, and I'll put in like 01-1899. We'll search and they won't find any records for this case. So that was search cases. So this case doesn't exist. So I'll create a screen. And since no one matches, we'll click here to create a new profile screen, which brings in the information. We'll just put in some basic information real quick about the case. We'll skip what we can. And then we'll hit submit. This takes us to the screen form. So we'll say you got the referral, say on, I don't know, we'll say 20 was the date of the screening. The referral came from another home visiting program, or it could have come from a health clinic. We'll just choose a referral source.
You have to put
the basic demographics about the person. You may or may not know them. It's not required. So the only thing required is the due date of the child. So you don't know the exact due date, but let's say the child's, the person's pregnant. So we can put in a future date, which can always be changed later. We'll say 10, 15, 20. That might be a little late. Say 08, 15, 20. And then we'll submit it. So then it sounds like the next thing that you're talking about is this, what do you call it? This next piece, which is the pre-assessment activity form. So that here, oops, I put the screen result as negative, my fault. True. We have to do some kind of screening. So then what I would do here is we would go to the pre-assessment activity form, which is exactly what I think you're talking about. 03-2019. Right, it's too far in the past. 04-2019.
No, your screen date is 2020, Chris.
Oh, right. No wonder it's not gonna let me do that. See, all the validation we have. Here's where it talks about the letters mailed to the parent or attempted visits or phone calls, right? This is what you're getting at, I believe.
Yeah, I guess we have a lot less information on the previous page that you were looking at.
The screen form?
Yeah, the screen form. Like we don't always know a lot of those questions when we get the family referred to us.
So the only things that are really required are, who the PC1 is, the TC, date of birth, and again, Chris, as long as it's an estimated, like as close as possible, that can be changed later. Most estimated due dates are not the true birth of the child anyways. And and we'd also where the referral is coming from. The rest of the information on the screen form is you can enter it at a later date, or it's not required. It's just there.
So then the screener would do some of this pre-assessment activities to then be able to answer more of the questions on the previous screen.
Right, and here they can choose at this point that engagement efforts are terminated, so that it's not going to go any further, the case is going to just close, or that they continue to the next month, or that they've actually done an assessment, and they're ready to complete the assessment.
And Beth, I just want to, if you don't have on the screen form on the demographics tab where you have those true false questions, if you don't know the answers to those, but you want it to be a positive screen, you can just enter the not sure or unknown. And that will bring up a positive screen so you can go forward.
So by choosing them all as unknown, it defaults to a positive.
Mm-hmm.
And then you can just say, yes, they're being referred. Referred is the only way you're going to get them to go to the next level of allowing the pre-assessment forms.
Right. And then you can start entering your outreach efforts under the pre-assessment.
I guess we have like two big separate, like how we outreach, like our community outreach team is outreach to get the new baby questionnaire completed. And then once they're, sorry, I'm only speaking for Clackamas. I know each program does things a little bit different. But then once, you know, the family screens positive, they're interested in visits, you know, and we have space for them, you know, then, you know, it's the home visitor that's outreaching them to schedule that first home visit.
Yeah, and that's very similar to, I mean, I think that the forms may have different questions and they're called different things, but it seems like everybody's going about it the same way. So our, you know, the screen form would be like a referral form, and then the pre-assessment activity forms would be the outreach efforts. And it's true, the workers in all the programs that we take care of in our MIS, they're really going fast and furiously to get that parent survey done, which seems to be the, you know, what you're calling the new baby questionnaire. And then after that is done, then it's handed off from an FRS to an FSS for the home visits and the intake, and then going forward. Does that make sense?
Yeah, there's no doubt that our model works slightly differently than Oregon's model. The important part right now is because I don't believe we have any state representatives here, is if you wanted to modify the model for Oregon, someone would have to be I don't know, like a spokesman for the state of Oregon to say, this is how we want it done. Because as you were saying earlier, Beth, you're speaking for yourself and your program. And if another program might do it a little bit differently, we want to make sure everyone's definitely, if you sign up, that is for the multi-site system, then we want to make sure everyone's using it the same way. And that you come to some type of agreement over when does the parent survey get filled out? When does the new baby questionnaire get filled out? What are the questions on those that get filled out? So that would be some customization. It's definitely something we can do. It's also something, though, that we would want to make sure that works for every one of you, not just 2 or 3 programs. Does everyone have the login that I gave out to a few people for just playing around with it? If you want to log in, just...
Yeah, most people don't have it, probably.
Okay. If you want to, you just go to... Actually, the easiest way to get to it is just go to HV Online. Actually, yeah, online.azurewebsites.net. So just remember this. I'll log out. Forget the log out part. This will be on the video, but if you want to write it down, you go to hvonline.azurewebsites.net, and the username, because it's just a demo site, it's all fake data, you go to, it's called demo user. DEMOUSER, and I'll show you the password, HFA 2020. And feel free to go around, play around with the application, things like that, add forms if you want, start a new case, go through it that way if you'd like to. the model's very flexible, but we just really would like to know what Oregon would want to use with everyone in agreement before making any changes to it. It would be expensive to change it 17 different ways, and then find out no one's really using it because everyone's kind of doing something different. So.
And also, while you're in the demo site, that tech support link that I showed you, the submit a ticket, that works. So if you want to submit a ticket and ask us questions, feel free.
Okay, any other questions? Okay, the last thing I'll do is we're most likely this, if you're gonna wanna look at the recording or send the recording to somebody, it's gonna be huge. And I don't think email is gonna work. So I'll send the link to Marguerite when we create it. We're gonna probably put this up on our YouTube page, and then you can just go to YouTube at a certain URL and then watch this again. If, I doubt anyone's gonna wanna watch this again, but anyone who hasn't seen it might wanna watch it for the first time. I don't think this has got a lot of rewatchability here, but who knows? Maybe it's like a Pixar thing and people are gonna love it.
And Chris, if people have additional questions, are you the one they should reach out to?
Myself or Corey, definitely. If it's about customization, it would be me. If it's about tech support and help desk stuff, then Corey would be your go-to person.
Yeah, if you want me to take you through any forms or anything like that, you know, I would be happy to do that.
So Chris, when you send me the link to the recording, if you could include Corey's contact information, and I already have yours, then I can make sure everybody has that for any follow-up.
Perfect.
And we obviously have a lot of work to do among ourselves here in Oregon and figuring out our next steps and how we move forward. So we'll be working on that on our end and also be back in touch with you guys.
Okay. Thank you everyone for joining us. That was, for us, it was a good afternoon. Hopefully it was a good morning for you.
Yes.
Thank you so much.
And have a good day.
It was
Nice to
helpful.
meet you.
Thank you.
Okay.
Take care.
Bye.
Bye.